Hello, and welcome to Introduction to Residents and Fellows as Teachers. Upon completion of this training program, the trainee will be able to explore how previous teachers impacted their learning, identify characteristics of effective and professional teachers, and also define how adults learn in the clinical setting. This program meets the LCME standards for preparing residents as teachers to medical students. It also meets the ACGME core competencies related to interpersonal and communication skills, as well as professionalism competencies. This Blackboard course was developed by Dr. Agatha ParksSavage with graduate medical education, Dr. Senthil Rajakaran with undergraduate academic affairs, and Melissa Scott, who is the Director of Student Rights and Responsibilities. The next part of this introduction will briefly review some of the overall practical teaching tips to keep in mind throughout this program. There are so many topics that we can cover. We had some challenges deciding which would be the most important for this course. Based on the literature that we explored, these 4 topics appeared to be the areas of focused attention: interns as teachers, feedback on the fly, teaching while admitting a new patient, and teaching professionalism. To meet the needs of busy residents and fellows, we designed this course to be delivered within an online platform where the trainees can have access to the course 24 hours a day, 7 days a week. Each module will have a VoiceOver PowerPoint, a self-directed reflection exercise, and then a module quiz. Each time you complete the module, you'll receive a milestone completion checkoff. The next part of this introduction will briefly review some of the overall practical teaching tips to keep in mind. Tip number 1, make what you teach relevant. Sounds easy enough, but you'll be surprised at what you teach sometimes doesn't really match what the learners want to know. This is where having clear learning objectives can take care of this issue. Tip number 2, there's a saying that if you do what you love, you'll never work a day in your life, and this is true on so many levels for many educators. And on this slide, you'll see some of EVMS's very own outstanding teachers. First on the slide is Dr. Frances Councilman, who in 2017 was awarded by the American College of Emergency Medicine Physicians an award for outstanding contribution in education. Second on the slide is Dr. Alfred Abu Hamid, who was chair of the OBGYN department and received Virginia's Outstanding Faculty Award for 2019. Last on the slide is Dr. Beverly Roberts Atwater, who in 2019 was named chair of the American Osteopathic Association Board of Physical Medicine and Rehabilitation. These 3 educators demonstrate the passion for teaching the next generation of physicians. Tip number 3, getting learners to ask questions is a great way to engage them in their own learning, and chances are they're going to retain the information even better. Tip number 4, engagement adds another layer of active learning. Sure, we can listen to a lecture all day and read books, but the process of doing and touching hits even more the senses to activate the learning process. Tip number 5, you're going to get into this topic a little bit more in the modules, but we wanted you to get started here. We all have a preferred way we like to learn. As teachers, it's going to be important for you to recognize what works best for your learners. You might observe this, or you just might want to ask your learners what style works best for them. For the most part, you'll be doing some type of blended style, a little bit of each of the ones that are listed here. Tip number 6, can you imagine not knowing how you're progressing or never being told if you were on the right track or not? The term feedback tends to get some negative attention, and it comes from teachers not knowing how to give feedback, so they do it poorly or they just don't do it at all. You're going to be learning several new ways on how to give feedback to learners in the upcoming modules. Tip number 7, along with being a teacher, you're also a cheerleader, a coach, and a motivational speaker all in one. Learners look to you for guidance and support, And in medicine, the stakes are high because of patient care. Learners need to feel like they can come to you when they do need your help and support and your encouragement. Your attitude may help facilitate this to occur and hopefully avoid a patient error. Tip number 8. You wear several hats as a teacher to medical students, and it's important to know how to keep boundaries professional at work and even sometimes during your personal time. For example, while some of you might find it funny to crack a silly joke in the break room, your comedy may be offensive to others. Another example could be working with a medical student that isn't the shining star of the group, and you decide to put this learner through a series of challenging questions in front of everyone with the intention to embarrass the student to make him or her study harder. Regardless of the action, maintaining your professional boundaries and professional attitude with all learners is something the students have a right to experience. Tip number 9. There will be times when your frustrations get amplified because of the lack of sleep after a busy call night or having a patient case go bad. Regardless of the reason, keeping yourself from distractions would be important as a teacher. When you do find yourself on the verge of losing your cool, step away for a moment, take a few deep breaths to clear your head. This can do wonders on just resetting the moment so you could start fresh. Tip number 10. Every successful person has made it to where they are today because of mentors in their life. As you develop your teaching skills, reach out to teachers that you've admired or have supported your professional development. Ask this person if they'd be willing to mentor you as you develop your teaching skills. This mentorship might involve co-teaching, co-presenting at a conference, and even creating manuscripts together for publication. Look for a person who is willing to give you the time, honest feedback, and models the skills that you hope to have one day. This last section is on the topic of teaching professionalism. Empathy is the ability to take the perspective of and feel the emotions of another person. Compassion is one's desire to help others. So ask yourself, how do you have empathy or compassion for colleagues, staff, medical students, patients, and their families? Does your behavior behind closed doors actually match how you behave in public? Teaching professionalism is more than just delivering the content over a didactic session. It's your actions, it's what you say, it's how you say it, and overall how you present yourself, not just when things are going well, but also how you present yourself when things are going bad. Having the self-awareness of your professional values and knowing how you manage your feelings when you are frustrated or in conflict will help you keep a step ahead. When you're building a team with medical students, your leadership and your professionalism skills will be on the spotlight. Students will look to you for guidance, so those professional boundaries will be important. This last slide addresses mistreatment of learners. And in this case, we're talking about medical students. When we bring this topic up with residents and fellows, we tend to get remarks like, "Oh, I've had this done to me before. I lived through it. It's not a big deal. Some people are just sensitive." This is not the case of someone just being sensitive. The actions listed here on this slide are unacceptable and has no place for the learning environment. Knowing this, are you an upstander? Somebody who recognizes something is wrong and acts to make it right? Or are you a bystander? Somebody who does not speak up or act when they see something wrong? For example, you witness one of your resident colleagues, who has a reputation for being hard on medical students and interns. She is raising her voice and rolling her eyes as a medical student fumbles through a presentation of a patient. You see the medical student become visibly upset, walk away from the team from feeling embarrassed, and is starting to cry. So what do? What would you say to that resident? And if so, where would you say it and when would you say it? Do you actually find the medical student and say something to that person? If so, what would you say? What about the other medical students that saw the behaviors of your resident colleague and appear visibly shaken by their medical student cohort walking away from the group during rounds, upset and crying? These are tough questions, but important ones to ask yourself. You can be prepared for this in many ways. To learn more about building your upstandard skills, Reach out to a mentor that could give you some guidance. You could even take part in EVMS's coaching program to help enhance your leadership skills. Our hope is that you would do something and you would be that upstander. This ends the introduction segment of the Residents and Fellows as Teachers. Through the online modules, it's our hope that you will develop the skills to set the stage for learning to take place, model professionalism to learners, reflect on your own teaching style and development, and engage in active mentorship with a trusted colleague that could help facilitate your development as a teacher. Thank you.